C-reactive protein was discovered in 1930, and the reason why this substance was called C-reactive protein is that this protein was present in the blood of patients with pneumococcal infection, and because this substance could precipitate the C polysaccharide from pneumococcal wall, this substance was called C-reactive protein. C-reactive protein was considered an acute phase reactant right after the discovery, simply because this protein was highly elevated in inflammatory conditions. And today we consider C-reactive protein a marker of inflammation. C-reactive protein is sensitive but non-specific marker of inflammation, and the most useful feature of this protein is the reactivity. In response to any inflammation, organism very quickly increase the production of this protein, and this makes C-reactive protein a great marker for detection and monitoring of inflammatory disease. The principle is very simple. Elevation of C-reactive protein tells us about inflammation. Decrease in C-reactive protein tells us that the severity of inflammation decreases, so most probably inflammation will resolve soon. And the higher the elevation of C-reactive protein, the more severe is the inflammation. C-reactive protein is produced by the hepatocytes, and with very severe inflammation, the level of C-reactive protein can reach even 500 in 24 to 48 hours. So this wide range and high reactivity makes C-reactive protein a great marker in monitoring of inflammatory disease. And the major factor that cause increase in C-reactive protein production are pro-inflammatory cytokines. The reason why we produce C-reactive protein during inflammation is that by coating of bacteria, this protein helps in bacteria killing, and by opsonization of dying cells, this protein helps to remove apoptotic debris. On this fancy picture, we can see the entire pathway of C-reactive protein in our body, but at first glance it looks a little bit complicated. So let's explain this pathway step by step. Hit that subscribe button if you have not already, and let's get started. C-reactive protein is produced in the liver from amino acids. Then hepatocytes secrete C-reactive protein into the blood, and the normal concentration of C-reactive protein in the blood is 0 to 0.3 mg per deciliter. The most common condition that causes increase in C-reactive protein is inflammation. It can be bacterial inflammation, it can be inflammation due to the tissue injury, or it can be systemic autoimmune inflammation. Inflammation induces the release of interleukin-6 and interleukin-1 beta, which are pro-inflammatory cytokines. And pro-inflammatory cytokines stimulate the production of C-reactive protein, which is actually a defensive mechanism. With increase in production of C-reactive protein, the concentration of C-reactive protein in the blood increases. And during inflammation, usually, the concentration of C-reactive protein is higher than 10. And the more severe is the inflammation, the higher becomes the concentration of C-reactive protein, which makes sense because C-reactive protein helps to fight bacteria, and also C-reactive protein participates in tissue injury. In bacterial infection, the crucial cells are macrophages, because the function of macrophages is to phagocyte bacteria, and macrophages on their surface have a potent negative charge. The problem is that bacteria are smart. They do not want to be consumed by macrophages, and to prevent phagocytosis, bacteria on their surface also have negative charge. And as we know, the same charges repel each other. And it's the moment when C-reactive protein comes into play. C-reactive protein binds to bacteria, and because C-reactive protein have a mild positive charge, by binding, C-reactive protein neutralize negative charge on bacteria surface, and this permits macrophages to come close enough to phagocyte bacteria. So C-reactive protein helps to fight bacteria infection. In addition to this, C-reactive protein participates in tissue inflammation. With tissue inflammation, a lot of cells undergo apoptosis, and cells that help to clean this apoptotic mass are macrophages. The problem is that macrophages are like blind kittens. It's very hard for them to find this apoptotic debris. So to help them, C-reactive protein binds to apoptotic cells, and by this C-reactive protein opsonizes them. And now such opsonized apoptotic particles become perfectly visible for macrophages that begin to phagocyte them. Also, C-reactive protein income to inflamed tissues, where C-reactive protein recruit additional neutrophils and monocytes to the site of inflammation. And as we know, neutrophils and monocytes are the key cells in inflammatory reaction. So by this, C-reactive protein mediates tissue inflammation. If inflammation becomes more severe, the concentration of pro-inflammatory cytokines increases even more. With increase in pro-inflammatory cytokines, the production of C-reactive protein increases. So now, with severe infection, the concentration of C-reactive protein becomes even higher. Let's say it's more than 50 mg per deciliter. With increase in C-reactive protein, the opsonization of the bacteria increases. As a result, phagocytosis by macrophages become even more effective. And also, with increase in C-reactive protein, opsonization of apoptotic debris increases. So it helps macrophages to clear the mass after tissue inflammation. And also, with increase in C-reactive protein, the chemotaxis of neutrophils and monocytes to the site of inflammation increase. So the more severe becomes the inflammation, the higher is the demand for C-reactive protein. That's why increase in C-reactive protein we consider a marker of inflammation.